Hi everybody, I'm Brian McMaster. This is Proactive Spine. Let's do our spinal floss. Arms up as high as you can. Hopefully as you do this more, you can appreciate reaching up higher, elongating up higher, string on top of your head, pulling you lengthwise upwards. Side bend, rotate, extend, feel all those segments in the spine getting involved, and squat. Great activation exercise for those spinal muscles. Step to the side, turn your foot in, rotate your body in the opposite direction, step back, step to the side, turn your foot out, rotate your body in the opposite direction, one time either side. Nice and easy. Okay, so the last few days we've talked about squats and using the thigh and pelvis muscles. Prior to that we talked about doing functional stretches to wake those areas up. Those are great. Big muscles down here though, they need a little bit more help. Massage is a great way to get to those. A little deep tissue massage. We often can't do that as often as we need. Foam roller can help a lot. And I'll grab one here and I'll demonstrate a good program to do and a brief outcome measure to see how much it's helping you. Load both sides, get both sides equally active, and identify, well, maybe my general exercises are missing some things. The trick with foam rollering is do it really brief. Try and do it symmetrically both sides. Don't be aggressive. You'll find some areas that are really tender initially, but as you do this brief and consistently, it's going to become less and less tender. It's just your body adapting to freeing areas up and getting circulation deeper to all the tissues. An area that's tender has usually been tight, fatigued, not allowing circulation through that area, and it's creating waste products are creating inflammation, okay, and tenderness and irritation of the nerves, the peripheral nerves. Okay, so here's the routine. We're going to get to all the thigh muscles briefly. Lying on your stomach. Actually, before I do that, let's just do a couple squats and appreciate how you feel. This is your outcome measure. How does that feel? Okay, if you're nice and loose, it feels pretty good, but let's see how it feels after doing the foam roller. So, front of the thigh, you want to get as close to the knee as you can and as close as the hip as you can. So back and forth once or twice. Turn your foot in and that will help you get the outer part of the thigh. Turn your foot out, that'll help you get the inner part of the thigh. And then turn the foam roller 30 degrees to your body. Bend your knee and work on the inner thigh. Get close to the knee, close to the hip. Turn your foot down, turn your foot up, get front and back of the inner thigh. Doesn't have to be much longer than what I just showed you. Outer thigh. Lie on that thigh, close to the knee, close to the hip, foot turned down, foot turned up. Okay? Some areas are really tender. Don't spend a lot of time on them. As you are consistent, that tenderness will go away. Don't really try and beat yourself up. Okay, and then back of the thigh. Close to the hip, close to the knee, turn your foot out, turn your foot in. Do the same thing both sides. Foot turned out, foot turned in. Outer thigh. Front of the thigh. Foot turned in, foot turned out. 30 degrees, bend the knee, inner thigh, close to the knee, close to the hip. Foot turned down, foot turned out. We don't have a lot of time to do this. I want you to do it consistently. Don't spend a lot of time. Stand up and recheck how well you can squat. And that feels much easier for me to get down deeper. Really valuable. There's going to be other things you can foam roller with, but that's a great tight routine. A couple squats before, foam roller to the front, back, inside and outside of the thigh, a couple squats after. I'm loading both sides easier. I'm getting down deeper, getting a fuller range of motion of those thigh muscles and how they interact with the pelvis. Really, really good routine, especially if you're doing consistent exercise, you need help recovering. That's a good one. I'm Brian McMaster. This is Proactive Spine.